I'm excited to share the research I've conducted on the effect of beta vulgaris on an in vitro oral microbiome of electronic cigarette users. My name is Daniela, and I'm a rising high school senior at American Heritage School in Delray Beach, Florida, where I'm a science research student involved in STEM competitions, Girls Who Code, editor of my school's science research journal, marine biology, and much more. One of my biggest activities is running STEM Squad, an organization that I created that teaches STEM to underserved children in my community through fun and engaging projects. I'm also a competitive volleyball athlete, playing as the libero for our varsity team and elite travel club team. I'm very interested in pursuing cognitive science and public health, hopefully innovating AI applications for health and education equity. We're seeing a global rise in e-cigarette use, especially among adolescents and young adults. According to 2025 global studies, over 83 million people use electronic cigarettes worldwide. And according to the CDC, in the US alone, almost 2 million middle and high school students reported current e-cigarette use in 2024. What many don't realize is that vaping doesn't just affect the lungs, it's also linked to unique oral health concerns. Studies have shown that e-cigarette aerosol can significantly alter the oral microbiome, leading to inflammation, dry mouth, and an increased risk for cavities and gum disease. More broadly, oral disease is one of the most widespread yet underestimated public health issues. It affects nearly 3.5 billion people worldwide. That's close to half the global population. Dental caries alone impact 60 to 90% of school children globally. These conditions disproportionately affect youth and underserved communities where access to regular dental care is limited or unaffordable. That's why it's important to explore natural, accessible strategies to support oral health, especially those that can be integrated into daily routines and don't rely on expensive interventions. Whether through diet, preventive habits, or microbiome-friendly products, these solutions have the potential to reduce disparities and improve long-term outcomes. Our study on beta vulgaris, or beetroot, offers a step in that direction. Our research objective was to determine whether beta vulgaris exhibited antimicrobial effects on the oral microbiomes of e-cigarette users in vitro. We hypothesized that the extract would reduce bacterial diversity and colony-forming unit counts, indicating the concentration of live microorganisms in samples. To test this, we collected saliva from 7 e-cigarette users and 7 non-users and cultured the samples on LB agar plates, a nutrient-rich growth medium, with and without beetroot extract. After incubation, we analyzed microbial growth. We also conducted 16S microbiome sequencing to examine microbiome composition, and we measured changes in pH. As seen in panel A, there was no significant difference in the total bacterial load between the saliva from the non-users and the electronic cigarette users. As shown in panel B, the pH of the electronic cigarette users was significantly lower, which may indicate poor dental health and/or enhanced susceptibility to tooth decay. Panel B here shows alpha diversity of our samples. Alpha diversity refers to the measurement of how many species are present in a sample. So low alpha diversity indicates that only a few species are present, whereas high alpha diversity indicates that many more are present. We see in panel B that the non-user saliva had higher alpha diversity than the microcosms grown in the lab, and the e-cigarette user saliva had a lower alpha diversity than the non-users. Further, the beetroot extract decreased the alpha diversity in both groups. Panel E shows the beta diversity of our samples. Beta diversity is a measurement that takes into account what species are present. Our results show the e-cigarette users had a significantly different beta diversity from the non-users, and again, beetroot extract supplementation impacted beta diversity. Finally, as seen here in panel A, Prevotella histicola was higher in the saliva of the e-cigarette users, and the 3 other species were higher in the saliva of the non-users. These trends are in agreement with Neisseria and most Streptococcus being associated with oral health, and Prevotella being more associated with oral disease. Panel C shows the differential abundance, which is a measurement that looks at whether the abundance of each species is changing between the study groups. We see the bacterial species that decrease in relative abundance with beetroot extract supplementation in the microcosms derived from the saliva of the e-cigarette users, again showing the beetroot extract made a significant difference. This pilot study found that beta vulgaris, or beetroot, has potential as a natural, accessible prebiotic. Further studies with a larger study group, following a time course of changes to the oral microbiome, along with saliva pH and other metrics of oral health, is needed to confirm our findings. Beetroot extract and other supplements that contain a lot of nitrate are showing promise as prebiotics that feed the good bacteria in the oral microbiome and therefore inhibit the growth of pathogenic or bad bacteria. I'd like to thank Professor Justin Nussbaum for helping me recruit participants and generously sharing his lab space for my initial experiments, and Professor Jonathan Baker for recognizing the value of my research and helping me to conduct key follow-up testing that strengthened the results. I'd also like to share my references. Thank you for listening, and if you're interested in contacting me, please use my email address. Thank you.